it's it's really great. I think patients want nutritional solutions more than they want, anything, I think, because it integrates with their life. And when I talk to a patient, it always comes down to, is there anything I can do with my food to make this better? And that's what they really want.
Well, that's really great, because if you get the right person on the right therapeutic plan for them at that moment in time, they're going to feel really different in 2 weeks.
Mm-hmm.
And that's one of the things that I love about using food as medicine. Is there was a group that I was teaching online, and one of the students said, sugar's my nemesis, and for this 8-week course, I'm not going to eat any sugar. Will anybody join me?
Hmm.
And so almost all of us joined her. And just from that one thing, we had one man who lost 30 pounds.
Hmm.
We had one woman who'd had migraines for 12 years, and her migraines were gone.
Hmm.
We had everybody reporting that they were sleeping better, and that their energy was better, and that their moods were better. And so you go, well, that was just sugar, but then you think about all the food that comes with the sugar, right?
Mm-hmm.
And so, that's just one inflammatory component of food. So that's what I love about it, is that people can see such huge differences in how they feel
Right.
pretty fast.
Yeah, and I think it integrates into their lifestyle versus, whenever I prescribe, let's say 2 or 3 supplements, then that's a whole new deal, right? They have to figure out, okay, where did I put the bottle? When am I supposed to take them? How am I going to take them when I'm at work or, traveling, versus, okay, today we're just going to make something slightly different for dinner, or it's it's just much more practical. And then also, I just think people don't generally, even though I really am a fan of nutritional supplements and dietary supplements, I think it's not the top choice from a patient standpoint.
Yeah. And we, as you said, we all have to eat. So it's just kind of making changes in how we eat.
Mm-hmm.
It's not saying, okay, so let's talk about your exercise.
Yeah.
And they go, well, I don't, and I don't feel good enough to exercise. And it's like, well, it's not optional. So
Mm-hmm.
let's try to figure out something. But again, it's like the supplements, now you're adding something new into what you're asking them to do, whereas food, you're just kind of expanding or contracting on what you're asking them to do.
Mm-hmm. Yeah. Yeah. And also, like, there's a nurturing component too, that I think a lot of people who are sick don't feel empowered. They feel, and they don't want to get into like the dependency model of healthcare. And then when they're nourishing themselves and feeling that they're feeding themselves something that's medicinal or healing, it's self-love. And I really see that, the quality of people from visit to visit change if they've started giving themselves healing foods or nutritious foods.
And that they're worth nurturing themselves that way. I love
Mm-hmm.
that. I say that all the time. Cooking
Mm-hmm.
for me is self-nurture. It's a creative outlet. Not that I'm terribly creative most of the
Mm-hmm.
time with it. And it's self-nurturing, and it's saying I'm worth it. I'm worth
Mm-hmm.
it to do this
Mm-hmm.
for myself.
Yeah, I'm the same way. I love to I'm I love to prepare food for myself and for my family, especially my family. It brings a lot of joy when people are just really enjoying the food, and I know that what was put into it, and who knows the impact that will have. It's pretty special. So yeah, and I think that's one of the things with the podcast we're trying to do is find this happy medium, because a lot of guests have talked about how some people become scared of food and go into restrictive patterns, but some people really feel pain from certain foods, and the restrictions based on a medical condition. And so you have to be sensitive, about where someone's at. that's the kind of line we walk a lot of times, is helping people expand their diet and embrace food again, but also if the food is causing pain, to really be clear about how to address that.
Yeah, and also to try to figure out, why is that food causing pain, and is this something that's permanent, like somebody who has celiac disease, or is this something that's based on something underlying, that is, they have leaky gut, or they have a low grade infection, or they have a parasite, or
Mm-hmm.
they have um, enzyme insufficiencies.
Mm-hmm.
They're not able to digest or absorb their food as well.
Mm-hmm.
So always kind of looking back, because it is kind of a trap sometimes,
Mm-hmm.
where people will start a FODMAP diet, or specific carbohydrate diet, or elimination diet, or ketogenic diet, and then
Mm-hmm.
they're like, well, okay, it worked, so here I am, and I'm just going to stay with this diet
Right.
forever. And I'll come back, I'll say, the ketogenic diet, when it was first given to people, it was for people with intractable seizure disorders.
Mm-hmm.
It was done in a hospital, and within in 3 months, they would put them back on a normal diet, and their
Mm-hmm.
seizures would still be gone.
Yeah.
And I think a lot of the reasons the ketogenic diet works so well is that it actually starves the microbiome, and the microbiome has to kind of regroup, and
Mm-hmm.
you also heal a leaky gut at the same time.
Mm-hmm.
And so you can start kind of starving off fungal overgrowth, and you can start starving off the microbes that are causing small intestinal bacterial overgrowth, and you're starving these things off, and the community and the mucous membranes get to heal, and that's why it works so well. It's not so much that it's a magic diet, but it's really a diet that allows for GI renewal. And
Right.
that's what's exciting about it. But if somebody feels like they need to stay on it for the rest of their life, then I'm always looking like, okay, well, what didn't get healed here, and what's underlying this, and what other issues are there?
Yeah. It's uh, yeah, and I think that's a really good point, because um, you know, when when it's used as a therapeutic intervention, um, then how do you bridge out of that once you've reached the outcomes you're looking for? Because I would imagine, going on the ketogenic diet is that you probably reach a critical point where the microbiome starts to get to a point where you lose some of the butyrate species and butyrate producing species, and um, I imagine, depending on how healthy you do it, I guess there's a lot of ways you can look at a ketogenic diet. There's like the research ketogenic diets, which is like a rat chow ketogenic diet, and then there's the well formulated ketogenic diet, which would be more with plants and healthy fibers and those types of things. When you're talking ketogenic diet, what's your kind of aim with people?
My my aim for those people is really, as much of a whole foods diet as possible.
Mm-hmm.
That's always my aim, no matter what the diet is how can we get somebody really to a whole foods diet? New research just came out using what's called a NOVA system, which kind of ranks the amount of processing that a food goes through.
Mm-hmm.
And they determined, in looking over like 230,000 different foods and packages. So, like, if you buy like spinach in a tub, that's a packaged food,
Mm-hmm.
right?
Mm-hmm.
But it's not a highly processed food.
Mm.
So they looked at all of these, and they determined that 69 point, I think 8%, wait, it was 70.8%, almost 71% of what Americans eat is ultra processed.
Mm-hmm. Yeah.
So just think, like, if we can just get people to only eating 10% of their calories as processed, highly ultra processed foods,
Mm-hmm.
how much better people would feel. So, my kind of ultimate diet always looks kind of like a Mediterranean diet.
Mm-hmm.
and it might be more weighted towards a vegetarian diet, or it might have more animal foods in it depending on the person.
Mm-hmm.
But we have research on a Mediterranean diet for pretty much all health conditions, that it's
Mm-hmm.
protective and preventive, from diabetes to heart disease to cancers to GI issues. And so why does it work so well? Well, probably because it's mostly a whole foods diet.
Mm-hmm.
And right now there's a big multinational research project going on comparing the specific carbohydrate diet, which is traditionally used for Crohn's disease and
Yeah.
inflammatory bowel disease, and using that to go head to head against the Mediterranean diet.
Mm.
And it'll be really fascinating to see what happens. I'm kind of rooting for the specific carbohydrate
Mm.
diet, but I think that because I think it's a really good therapeutic diet, not necessarily a lifetime diet.
Mm-hmm.
And, you know, when we go on these kind of specific carbohydrate or FODMAP diet or ketogenic diet or Atkins diet or any of these, they're really as much diagnostic as they are treatment,
Mm-hmm.
because they tell us a lot. I know that you in your practice, it's like, so how, when we start adding foods back in, then how do people feel,
Mm-hmm.
right? And so you can really find people who have lactose intolerance or having reactions to eggs. Like I had one client who, we did a comprehensive elimination diet. I recommended one, and she did it. And as she added eggs back in, her heartburn would come back every
Mm.
time she would eat an egg.
Mm-hmm.
And she's like, "Oh, look at that!" And she's like, "Okay, so like if I decide to have an omelet, then maybe I should have enzymes or something,
Mm-hmm.
you know?" Um, but mostly she chose not to eat eggs. But that was her choice because she was educated about like what eggs, how they made her feel, and they made her feel bad.
Mm-hmm.
And so these diets, when we start taking foods out and then we add foods back in, when you take foods out and somebody feels like $1,000,000 in 2 weeks, you see their arthritis disappear and their irritable bowel syndrome, and their mood starts lightening and their
Mm-hmm.
depression lifts, and you can see all these changes that happen in 2 weeks.
Mm-hmm.
And then as you start slowly, I like people to do it at least 4 weeks, but I lie and I say, let's do it for 2 weeks and then
Mm-hmm.
come back and we'll talk about it.
Mm-hmm.
And then we reevaluate. And if they're willing to do another 2 weeks, then we go another 2 weeks. And if
Mm-hmm.
they're saying, I'm desperate for X, then we kind of try to do that, and renew that and start adding that food back into their diet like 2 or 3 times a day for the next 2 or 3 days.
Mm-hmm.
Because sometimes the first day somebody eats something, they go, yay, no problem.
Mm-hmm.
Second or third day, that all of their symptoms just kind of bloom again, and they go,
Right.
oh, okay.
Yeah, that's that delayed sensitivity reaction. Yeah. Yeah, it's I think that's a good point. And one of the things I do really appreciate about the SCD diet is how they've developed stages. So there's stage one for really acute flares, and kind of you can graduate to a maintenance stage 5 SCD. I think that's really helpful for patients and also for communicating the severity of their flare. And I think it really works clinically when patients are following the SCD diet, that if they're moving through that, we can really adjust as far as like medicine and other therapies that need to be placed on board. That tells us a lot.
Yeah, you had wanted to talk specifically about inflammatory bowel disease.
Yeah,
And
I think there's a
yeah.
there's a couple things like I wanted to just talk about that. And also I think you've been a really big influence on my career from with the 5R model. I think that's with I probably was developed through lots of colleagues at IF Institute of Functional Medicine, and lots of influences I think brought it to the forefront. But I would like to just hear about where that's at today, um, and then the Digen model that you talk about in your the textbook. Uh, the 5th edition, I think, is coming out in a couple weeks. But
Yeah.
it's so exciting.
Yay.
I would love to talk about that model of digestive wellness and how that's such a great roadmap of healing the gut. So if any of those are areas that you would be happy to go into, I'd love to talk about that and then circle back about the inflammatory bowel disease if we still have time.
Absolutely. So the 5 R's started out as 4 R's, and they really came from, I think, originally Dr. Jeffrey Bland and the Research Institute for Functional Medicine. And the idea is that we start thinking about using the 5 R's for treatment of digestive issues. So to kind of go into them, and I don't have them written down right here, but to go into them, the first one is remove. So it's like, what are you doing in your life that you need to change? Are you eating a lot of sugar? Are you smoking cigarettes? Are you so stressed out that you're wired when you go to sleep and you can't sleep well? What are some of the things that are in what we would call them in functional medicine terms? What are the um, mediators? Like, what are you doing in your habits that keep you from not feeling well?
Mm-hmm.
So to recognize what those are, so remove those things, and then to replace them with other things. So, okay, well, if I'm taking out sugar, maybe I can eat more fresh fruit. If I'm taking out gluten from my diet because I think that makes me feel sick, maybe I can start eating more brown rice or quinoa or millet because maybe those grains are better grains for me. Um, for stress, well, maybe I can meditate like 10 minutes twice a day, or even meditate 10 minutes once a day. Or for my stress, maybe I can try to modulate my stress by making sure that I get outdoors every day and just go for a walk. So, so we've got the remove and the replace. And Dr. Sid Baker, who's one of my mentors, has said, what does this person need to get rid of and what do they need to add? And
Mm-hmm.
so so those are the first 2 R's. And then we have what we call reinoculate, which is um, probiotics and prebiotics. And I really love to do that mostly with food.
Mm.
It wasn't until the last maybe 40 years that we had little pills and powders that were called probiotics and prebiotics,
Mm-hmm.
or even newer, maybe the last 20 years. Maybe lactoferrin was the first prebiotic to be put in a little package.
Mm-hmm.
But, people historically have always gotten probiotics and prebiotics from food. And that's always my first go-to. And so when you think probiotics from food, you start thinking about cultured dairy products. So things like yogurt and kefir and hard cheeses, um, freshly made buttermilk, things like that. And you can make non-dairy versions of those as well. So you can make a tofu cheese or a cashew coconut kefir or a soy yogurt or any combination of those.
Mm-hmm.
So those are kind of cultured dairy-like foods. And then we also have all the cultured vegetables like beet kvass and kimchi and sauerkraut and half sour pickles that you just make on your counter in 2 days.
Mm-hmm.
They take 5 minutes to stuff in a jar, and then you let them sit for 2 or 3 days and you've got pickles. So, I really love that. And then prebiotics are the food for the microbes in your microbiome. And so those foods are soluble fibers, so like oats and beans and lentils and root vegetables and artichokes and black tea and green tea and honey all are loaded with vegetables. They're all loaded with these prebiotic fibers. And also what we've learned more recently in the 2017 consensus statement on prebiotics is that all of the polyphenols and the colors in foods are also prebiotic, and
Mm-hmm.
they have this amazing relationship with the microbiome in that when I eat blueberries, which I did this morning in my smoothie, when I eat the blueberries, that the activity of those polyphenols in the blueberries is only about 5%.
Mm-hmm.
But when they get gobbled up by the bacterial enzymes, then what happens is they get activated to be anti-inflammatory and to protect my vision and to help control my blood sugar levels and do all these other things.
Mm-hmm.
So, it's a beautiful relationship. So we want to kind of repopulate the microbiome. So that's like the third R. And then the fourth R would be about kind of he, healing the leaky gut.
Mm-hmm.
So that's repair. And then the fifth R is for me about we were sitting down at the Institute for Functional Medicine about 11 years ago thinking about the GI module that I co-teach. And I said, you know what? I think we need a fifth R. And that fifth R is really about um, renewal and reconnection. And sometimes, so it might be about meditation or acupuncture or reconnecting with an old friend or something like that. But for me, it's also about what's your new normal, because we have a lot of times like they get diagnosed with ulcerative colitis, for example,
Mm-hmm.
and all of a sudden they think of themselves as that disease,
Mm-hmm.
right? And maybe they're never going to be as healthy as they were originally. Maybe they're going to need to take drugs for that, or
Mm-hmm.
maybe they're going to need to change their diet or change their job or whatever. So, like, how do we come back to that new normal?
Mm-hmm.
And then we also have people who've been sick for so long that their life is kind of wrapped around being sick. And how do they find a new normal when they're not sick anymore and they
Mm-hmm.
feel really good and all their relationships are built around being sick?
Mm-hmm.
So all of these things to me, so that's kind of like when we think about the 5 R's, we think about what's really the treatment for GI issues.
Mm-hmm. Yeah, I really like that addition of the last step, or the fifth R. It's it's important because I think you see that people need to move from sickness to wellness, or sickness to doing better, or just to kind of drop the sort of lifestyle of being sick. And that's a big process in itself, and there's a lot of grief associated with that too, due to time lost and relationships that have changed. And so it's really great that you've taken a step to address that. I imagine counseling would be part of that step.
Yeah. And the replace step, you might use digestive enzymes, or if somebody's lost their gallbladder, might be using ox bile or lipase loaded enzymes, or some people might need bitters to
Mm-hmm.
stimulate stomach acid production. And so there's nuances to it, but the 5 R's are really about like how do we think about moving somebody from where they are to where they'd like to be.
Okay.
And the dig-in model is more about how do we actually think about where to start.
Mm-hmm.
Um, I was sitting in an airport with Dr. Patrick Hanaway one
Mm-hmm.
day, and he said this really brilliant thing to me, which I was thinking about this morning in the shower because that's where I think. And and I was thinking about that day when he said this. He said, no matter what somebody's diagnosis is, when we're talking about GI issues, I think there's really only like 5 main underlying factors.
Mm-hmm.
So, for example, if somebody has Crohn's disease or ulcerative colitis or gastritis or GERD, you know that there's inflammation involved.
Mm-hmm.
and there's probably also an immune reaction involved because some of those are actually have an autoimmune component.
Mm-hmm.
Or when we think about autoimmune disease, we know that there's almost always, if not always, a leaky gut involved with that. So that's increased intestinal permeability.
Mm-hmm.
And then he said, and then there's the gut microbiome, and then there's the gut brain, the enteric nervous system, and
Mm-hmm.
how that works. And how well are people actually digesting and absorbing and moving their food through?
Mm-hmm.
So he gave me these like 5 concepts, and I sat and I shuffled them around, and I said, you know what do you think about dig it or dig in? And he said, I like dig in,
Yeah.
So that's where we came up with that. And you know, and it's so useful because if you're working with a patient or you are the patient and you start thinking in the terms of like, well, first, can I digest and absorb my food? And do I have motility issues? So for somebody who's got constipation or somebody who has um, maybe MS or Parkinson's or
Mm-hmm.
somebody with what we call gastroparesis, all of these have motility issues.
Mm-hmm.
So, they're pretty simple things like adding more fiber, drinking more water, taking magnesium, you
Mm-hmm.
know, um, having extra vitamin C that can really help with this motility, right?
Mm-hmm.
Or for digestion and absorption, as I mentioned, maybe they need enzymes or something to support stomach acid. Um, so is that their problem? Because that's kind of the beginning of digestion. If you can't get the nourishment to the cells, well, then you've failed.
Mm-hmm.
And then the second piece is, do they have increased intestinal permeability or leaky gut or what we call impaired barrier function,
Mm-hmm.
which has been associated with, eczema and asthma and psoriasis
Mm-hmm.
and migraines and fibromyalgia and autoimmune conditions and pretty much you name it.
Yeah.
Any weird kind of thing, we've
Yeah.
got a lot of kind of leaky gut.
Mm-hmm.
Um, and so addressing that, like, does this person have that? And then their gut microbiome, do they have dysbiosis? Do they have a low growing infection or parasite
Mm-hmm.
that could be fungal, bacteria, or parasitic? And can that be treated? So to put it back into context of IBD, I remember I was working with that man a long time ago, and he had ulcerative colitis.
Mm-hmm.
And so I said, let's try this diet, but also I'd love to do some stool testing on you.
Mm-hmm.
And I asked his gastroenterologist to order us a fancy stool test. And when the results came in, the gastroenterologist, I looked at the results and I said, look, he's got amoebas.
Mm-hmm.
He's got amoebas. Will you treat the amoebas? So the doctor said, Liz, he's going to be on steroids the rest of his life. He has ulcerative colitis. This is just the way it is.
Mm-hmm.
But then when he got his amoebas treated, his ulcerative colitis disappeared.
Mm-hmm.
So I think looking at kind of dysbiosis and using again IBD as an example, we're getting more and more research that demonstrates that Crohn's and colitis both have dysbiosis, an imbalanced microbiome at
Yeah.
the root.
Yeah. And yeah, I want to go deeper with that. If we can just ask you a question about that, because it seems as though
Sure.
not too long ago I was invited to a local gastroenterology clinic to roundtable with the GI docs, and they they wanted to meet naturopathic doctors, and so they invited me, and it was a very great kind of productive collegial conversation, and we were talking about IBD and how they they know what to do about getting people out of a flare or potentially stabilizing disease with biologics. But the biggest issue is figuring out if someone is actually flaring or they're dealing with like a dysbiotic flare. So they're always walking this line. So I'm glad you brought that up, and it seems like dysbiosis, and I want to hear your comments on this. Dysbiosis is maybe an underlying push or driver for inflammatory bowel disease, but also it actually gets worse with some of the biologics. It's harder to manage once they're on biologics. That's just my impression in some of the study and research I've looked into, but I want to hear your thoughts on that just to see if you would agree or what your experience is with like dysbiosis being harder to manage once there's some immune suppression.
Yeah, I'm not in practice right now,
Mm-hmm.
so I'm not seeing it, and the biologics are relatively new,
Mm-hmm.
but we certainly saw this when people were using steroids
Mm-hmm.
because you get this kind of rebound.
Mm-hmm.
And I think the same thing that I've seen with the biologics is that people kind of get hooked on them,
Mm-hmm.
and they suppress the immune system, as you said,
Mm-hmm.
TNF alpha and other inflammatory markers, and so they always keep you suppressed. And so then there's this possibility that as you start withdrawing somebody from these, that they're going to flare up.
Mm-hmm.
However, um, I've seen people, and then you've got the other thing where, and then if you keep giving antibiotics,
Mm-hmm.
that can make the inflammatory bowel disease worse
Mm-hmm. Mm-hmm.
because
Yeah.
now you have even more dysbiosis.
Mm-hmm.
Um, and, most people will really bounce back within a couple weeks of taking a round of antibiotics. But if you keep giving somebody antibiotic round after antibiotic
Mm-hmm.
round, then they're not going to necessarily keep bouncing back. And we
Yeah.
see this with ulcerative colitis and Crohn's.
Yeah.
So yeah,
Yeah.
it's not an easy question, and it's one I was talking with some colleagues just the other day about. It's like, well, okay, if you've got somebody on one of these biologics, then why not send them to you and have you work with lifestyle and
Mm-hmm.
diet and maybe do stool testing
Mm-hmm.
and breath testing. We see huge amounts of small intestinal bacterial overgrowth in
Right.
people with IBD, and the gastroenterologist certainly can be doing that, right?
Yeah. Yeah. I mean, if they had the time and the resources, because that's that type of work is really high touch care, right? I mean, it's you have to have time to work with patients and spend time with them. I think that's the challenge that they face. And
Yeah,
now we have
but
a
most of them do have breath tests for
yeah,
doing SIBO testing right in their office.
right. Yeah. Yeah, we're seeing that, and then it's just the management of of the SIBO from there. That's luckily a number of them are starting to hire GI dietitians that are learning some ways to help with SIBO, and yeah, referring out to clinical nutritionists, naturopathic, functional doctors, functional practitioners. But so I don't want to sidetrack you from what we were digging in on. I'd like to keep digging.
Okay, so we did D, digestion and absorption. We did I, intestinal permeability. We did G, gut microbiome. And then the next I is inflammatory immune. So IBD is definitely one of those inflammatory immune conditions because you've got that, but you can have inflammation pretty much anywhere in the GI tract. You can have gingivitis, you can have esophagitis, you can have gastritis, so you can have inflammation anywhere. And then you can also have immune activation from food sensitivities, environmental contacts, dust, mold, even something like eosinophilic esophagitis. It's basically like allergy of the throat. I
Hmm.
kind of like to think of it as asthma of the throat.
Yeah,
It constricts, and people have really high eosinophil counts,
yeah,
but that are found on biopsy. So it's like, well, that sounds like allergy to me.
right.
So think about immune, think about inflammation as the next I, and then thinking about N, which is the enteric nervous system.
Mm.
And that is so cool because we're just starting to see more and more research on the relationship between the gut and the brain, and they're connected through the vagus nerve. And the vagus nerve is connected to the brain, which then stimulates the hypothalamus to say, hey, everybody else, this is what you need to get cooking on.
Mm-hmm.
And then the vagal nerve also interacts with the gut to see about, increased permeability or healing or different things. And so what we know is that most of the conversation is from the gut to the brain. About
Mm-hmm.
90% goes that direction, and
Mm-hmm.
10% goes from the brain to the gut. So, for example, like if I'm feeling depressed or stressed, I might eat all the Halloween candy that's left over,
Mm-hmm. Yeah.
right? It can affect what I eat, and then what I eat, eating all that sugar, can affect my gut. On the other hand, um, I could have a, a dysbiosis in my gut that makes me depressed and anxious,
Mm-hmm.
or I could have schizophrenia, which when like we have one researcher, Dohan, who actually worked with men who were in an institution for schizophrenia, and he put them on a gluten and dairy-free diet,
Mm-hmm.
and two-thirds of them improved.
Hmm.
Two-thirds. We've got dozens of papers on gluten and schizophrenia. So is it the whole story for most of them? No, but how many of them actually just have undiagnosed celiac disease or
Right.
non-celiac gluten sensitivity or leaky gut?
Mm-hmm.
And so it's starting to look at this whole relationship between the gut and the brain,
Yeah.
and the vagus nerve, as you know,
Mm-hmm.
it's the chill out. When we sit down to meditate, or we get acupuncture, or we go for a walk, or we have a beautiful meal with friends, or listen to comedy on TV.
Yeah.
Those things are like feeding that sympathetic nervous system, and in our daily lives we're just on parasympathetic, because we're mostly just on go go go, which is the sympathetic nervous system.
Yeah. Yeah. And it's really wonderful these days. Like in my clinic, I have a monitor that's made by this company called Heart Math, and it's called Inner Balance. And it's just basically a device if people are not grasping this concept of, do I have poor vagal tone, or, if I have vagus nerve problems, we can just kind of monitor them in the clinic, and we can see how good their heart rate variability is, which gives one good indication of vagal tone. And I think it's alarming to people, because it's really hard to sort of, if you ask someone, how's your vagus nerve functioning, it's really hard to say good or not so good. But the heart rate variability is one of those ways that we can say, you know what, it's really out of tone. Do you use that, or is that something that you're interested in?
I'm interested in it, and I have a little meter, like a personal meter,
Uh-huh.
and I've like like put it all into my computer, and then I've tried to use it a couple times when I'm in a national park where I don't have internet, and then it doesn't work. So we haven't like figured out how to merge our relationship so that it works really well, but
Yeah.
I'm looking forward to it. Last week, though, I tried something different for the first time. I tried frequency specific microcurrent,
Hmm. Okay.
which is similar but different.
Mm-hmm.
It's being used for fibromyalgia and pain syndromes and
Mm-hmm.
different things, but the program that I put on it was like peace, what was it called? Rest and stress, or something
Mm-hmm.
like that. And I left there kind of like I've left when I've done heart math work,
Mm-hmm.
is all of a sudden this great peacefulness was in me,
Mm-hmm. Yeah.
and it's lasted for days. It's like, wow, there's this, I have a lot of things on my plate right now with the
Mm-hmm.
book coming out and a course coming out to go with the book, and all of this, but this great kind of underlying peacefulness.
Mm-hmm.
And I think when people are doing heart rate variability with heart math, they feel that same kind of peacefulness.
Yeah. And then if you in tying it into what that provides the digestive function. I mean, it's such a great mind gut treatment or lifestyle, I should say. Um, so, well, before we go into hearing about your book and some of the other things you're working on, I'd just like to go into IBD just a little bit more. And so, I think if in a dream world, I would have this practice where I'm like there's a nutritionist that's really skilled, kind of working side by side with me, and I do work with nutritionists quite a bit, but just in these moments in a clinic room, a patient comes in with ulcerative colitis or Crohn's. I'd say of the two, ulcerative colitis is the most tricky dietarily in my experience, and they're been told they need to go on Remicade for life, which is biologic for life, and this is going to keep them from having any surgeries and resections, and so they're bought in with that, and that's something that has been decided on and committed to, yet they're not stable digestively, and they want to know what is the best way to dietarily manage colitis, ulcerative colitis. And so we sit there, and it's like quite a puzzle. And I'd just like to hear your thoughts about if that patient was in your clinic, your room, or just if you were consulting on that patient, what's the first conversation look like for you?
Well, the first conversation is I'm nosy. I want to know all about their life. I want to see a food diary. I want to know about their exercise and their sleep and their relationships, and do they feel heard, and do
Mm.
they feel loved, and do they feel lonely? I want to know kind of all of that
Mm-hmm.
because for me that's, kind of the basis of overall health. So I want to start with not the shiny, fancy things, but I just want to understand like their life. I also want to find out like when did their ulcerative colitis begin? Was it a sudden thing or did it happen slowly over time? Because sometimes if it was a sudden thing, then you can kind of look at it and say, aha, like this started after you went on a vacation and you had food poisoning
Mm-hmm.
or you got dysentery or whatever. I had one person I was working with, a young woman, and she went to Morocco and she came back from Morocco with ulcerative colitis.
Mm-hmm.
So I'm like, huh, in that case, I want to do some fancy stool testing. I want to really look and see, well, is there maybe an infection of some sort that's driving this? Could
Mm-hmm.
there be a parasite that maybe even got treated, but there's still small amounts of it, just enough to keep this simmering,
Mm-hmm.
right? Um, and I do want to use that dig in model to kind of try to suss out like what's going on.
Mm-hmm.
Um, like I remember one time I had this woman, she was uh, taking biologics, she wasn't feeling well. Her ulcerative colitis kept flaring up, right? And so we're having a conversation, and one of the great benefits I always had of working for myself and having as much time as I needed to spend with people was I could kind of ask a lot of questions. And
Mm-hmm.
so, because I was taught that if I asked the right questions and I gave people time, they would tell me 90% of what I need to know.
Mm-hmm. Mm-hmm.
And so she said, last winter I had bronchitis, and my doctor gave me penicillin for that. And when I took the penicillin, my ulcerative colitis went away and it was gone for about 3 months.
Mm-hmm.
And I said, huh, well, why don't you see if your doctor would give you some more penicillin,
Mm-hmm.
right? And so he or she did, and her doctor, and she felt fine as long as she was taking the penicillin. She's like, well, now what?
Right.
And I said, well, I'm not a physician, but either you're not on the right dose of penicillin or it's not the right antibiotic for you. But this demonstrates that what's going on is that you have an infection that hasn't been treated adequately,
Mm-hmm.
and that it keeps driving that ulcerative colitis.
Mm-hmm.
So, I also really I would want to give I would want to, as you say, like diet and inflammatory and ulcerative colitis, it's tricky. It's
Mm-hmm.
really tricky because sometimes it isn't really their diet.
Mm-hmm.
With Crohn's disease, boy, especially in kids, but in adults too, we're starting to see really good research on the specific carbohydrate
Yeah.
diet as being so useful. So if that works for somebody with ulcerative colitis, great. But if it doesn't, then you start wondering, well, okay, do we do food sensitivity testing and
Mm-hmm.
see if there's something there? Start do we start looking at other things? I remember going to a Crohn's and colitis meeting once. I was a speaker, and quite honestly, I didn't stay on their slide deck very well.
Mm.
Um, but so I probably didn't get asked back for that reason. But anyway, but there were several people who stood up and they told their stories of healing from inflammatory bowel disease.
Mm-hmm.
And what I really took away from those people who were brave enough to talk about it was that there is an emotional, spiritual component to this disease, to
Mm-hmm.
these diseases.
Mm-hmm.
And that if we don't address those with something that people aren't ultimately ever going to kind of get past this barrier of really getting well. And it doesn't say that everybody's going to get 100% well,
Mm-hmm.
but I've seen people with homeopathy, it really works. I've seen somebody with shamanism, and he feels like that absolutely cured his Crohn's disease.
Mm-hmm.
I've worked with somebody who acupuncture was her main issue. She
Mm-hmm.
used that as her energetic medicine.
Mm-hmm.
Um, Counseling can be really useful.
Mm-hmm.
When we're working with somebody who has a chronic illness, we love to work with what we can see,
Mm-hmm.
but so much of what is happening is probably a blockage that happened when they were 5 years old, or when they didn't feel loved or didn't feel good enough, or when their parents got divorced, or
Mm-hmm.
when one of their parents died, or when they felt unsupported or abused or traumatized in some way. And
Yeah.
so I love that you're using heart math, because I think that all of these more softer, energetic kind of techniques like homeopathy, heart math, um, frequency specific microcurrent. I used to use something called life alignment,
Mm-hmm.
holographic repatterning, counseling. Like all these things, they can
Mm-hmm.
hypnotherapy, guided imagery. All these things can kind of unravel some of those blockages that keep us sick.
Right. It makes a lot of sense. Yeah, and I think that is, you know, um, when I've had the great joy and privilege of seeing someone go from sick to getting well, you hear these conversations come out in the interchanges with what they're sharing is like, I used to be so hard on myself about every little thing, and I've learned to really give myself some compassion and I've established more of a balance mindset to what I need to achieve and the way I look at myself. And you know you hear these conversations, and I think I mentioned this in a previous episode. I always, at that point, I feel like I can just sort of like step back and say, the work is, here they're moving on. They're in a better place, and they're in a wellness state, because that is often the obstacle to cure. But we don't want to take away from all the real physical, mechanical balancing that we have to do as well. One thing that what you mentioned, I just wanted to point out, is there's like a new tool out there called the Adverse Childhood Event Survey. I have been using that with patients just to get them to have a concept of the sheer volume of of events that might have impacted their health growing up. Like a lot of people downplay certain things that have happened in childhood because it's like, what can you do about it? But I like people to use that tool to just really see where they score as far as the cumulative experiences they've had in their life that may have impacted their health.
Yeah, it's that work continues to grow, and it's really fascinating. It's a pretty simple questionnaire,
Yeah.
and you read it and you go, "Oh yeah, like, huh, that happened, or this happened, or and almost everybody has at least one of those in their childhood."
Yeah. Yeah, but and then if and I think the more events, and they do a really good job of tiering the different types of events that could have made an impact. And then patients who will claim that they've had just a really remarkable childhood and it was like a storybook childhood. Yeah, they'll score really well on it, and it's like it does give some good information. So, well, I've really enjoyed this, Dr. Lipski. This has been really exciting for me to learn these models a little bit straight from who I consider one of the key influencers in the field of functional medicine. This is a really exciting for me to have this conversation, and I wanted to take just a few minutes here, or as much time as you want, actually, just to talk about your upcoming book and anything else, the book release, and anything else that you'd like to share with us about what you're up to these days. And just also, if you could
Sure.
just leave us with a take-home message or two.
Okay. I love all of this. So, first of all, the last year and a half, I've been working on an update, a fifth edition of my book, Digestive Wellness. And I just want to say, like, when I first wrote it, I didn't really know that much, and I wrote it because I wanted to know more. So if you have an idea of something that you just want to know more about, like you and I were talking about, well, why are you doing the podcast? Well, I get to talk to all these really interesting people, right? And I
Mhm.
get to learn. So I think being brave enough to kind of have a vision and follow it through is, a piece of it. And then every once in a while, that vision resurfaces and says, oh my gosh, the field has changed so much, and there's so much more that I want to add, and my understanding has grown or changed. So the fifth edition is a really big update, and it's coming out late in November, and I'm really excited about that. I can't wait to have a copy in my little hands. Um, and then I also, while I was writing it, I had this feeling while I was writing, going, oh, there's only so much I can put in a chapter. I'd really like to take it and make a course and make a little video course to go with it.
Mhm.
And I mentioned that to my husband. I was just going to sit on Zoom and do it. And he's like, no, 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 let's hire a videographer and let's do it right.
Mhm.
So I have a course with over 20 little videos about me really explaining the different diets and how I think about them, and explaining the 5 R's and the dig-in model, and um, so many like the gut brain and cardio. Like how's diabetes related to the microbiome, or
Mhm.
liver disease related to the microbiome?
Mhm.
So created this course, and it also has 9 cooking demos and dozens of recipes and handouts on that clinicians can use in their own practices and that
Mhm.
patients can use for themselves. So I'm really excited about that and
Mhm.
working on that right now. So, and then my other thing that I'm just always doing is teaching. So I teach for Maryland University of Integrative Health in
Mhm.
both their doctoral and master's programs
Mhm.
in nutrition from a more integrative functional lens.
Mhm.
So um, life is always interesting,
Mhm.
and it's really good. So I guess parting words is, I love how the body wants to heal itself, and if we give it the right environment and we seek out people who have tools that are maybe different,
Mhm.
that we can feel better than we do.
Mhm.
And medicine focuses on really, the main focus of medicine is kind of maintenance of status quo and bringing people out of emergency acute
Hmm.
situations, um, and bringing them, like to a better place, as you were
Hmm.
saying with when you were talking with the GI docs. But it doesn't have really good tools for really helping people optimize their health.
Hmm.
And I think that's where nutrition and naturopathic medicine and acupuncture and chiropractic, um, they really come in, where we are really learning about ourselves. We're learning about what works in our own body, and we're getting the tools that really teach us how to do better self care.
Hmm.
So I think we can all feel better like a year from now, hopefully, than we
Hmm.
feel today.
Hmm.
And that said, the human body does really weird things,
Yeah.
and that's part of our spiritual journey in life. And so, a disease is teacher.
Hmm.
I've certainly had my own moments of it.
Hmm.
And, so, to kind of go with the ebb and flow and just kind of look at it as an observer sometimes,
Yeah.
instead of being like so stuck in it.
Hmm.
Um, so I remember I was I was getting testing done. I have a genetic disease called polycystic kidney disease, and I got a kidney transplant from my sister 15 years ago.
Hmm.
But I remember I was like getting the testing done, and I was starting to freak out. And then I'm like, well, what's really happening right now? Oh, well, like I'm sitting in this really quiet room, and
Hmm.
I can just like be, and I don't
Hmm.
have to be freaking out. I can
Hmm.
just like be in the moment. And so it's like that, having, going through a kidney transplant, it gives me a lot of empathy.
Yeah.
But also, my kidneys, when I would have conversations with them, I
Hmm.
would say, like, well, what do you need? Like, what do
Hmm.
you need? Like, what should I be doing? And their answer was, oh, we need a new kidney.
Hmm. Yeah.
And I'm like, okay, well, I have to just surrender that there's nothing more I can really do.
Hmm. Hmm.
So I think being where you are is really important. And then I also think about not just accepting a diagnosis and saying, okay, so this is my diagnosis, but what else?
Hmm.
What else can I do? Because I think for so many people, their diagnosis is kind of the end of their journey. It's
Hmm.
like, yeah, I'm just going to take Remicade the rest of my life.
Hmm.
Or I have migraines, so I'm just going to take these medications the rest of my life.
Hmm.
And it's like, well, maybe, but maybe there's something driving it. Maybe there's something you can do.
Yeah. 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 I mean, it sounds like such a balanced perspective of, balance between, addressing what is and being in a place of acceptance, and also taking action to, what you may have some influence and be able to improve, your overall health and status of whatever you're managing. So it sounds really balanced. Thank you.
Thank you. It sounds like you have a great practice and such a lovely perspective on
Thank you.
working with people. Your
I
patients are very lucky.
Thank you so much. I really enjoy and am grateful for my patients and just enjoy this field very much. So I'm glad to hear that was your impression. Thank you. Well, I guess I have already ordered my copy, so and I'm excited for it to show up. I've got it already ordered through Amazon. So um, if I'll put in our show notes some links to how people can order the new edition of Digestive Wellness, and links to all the other great work you're doing. And is the video series going to be able to be purchased through your website, or does it come as part of the book purchase?
No, it's going to be purchased separately from my website
Okay, so we'll
at
put.
innovativehealing.com,
Okay,
but
great.
it's not up yet. Yeah,
Okay,
so it will
excellent.
be.
Okay,
It's all in process.
all right. Well, excellent. Well, thank you for your time, and I look forward to crossing paths with you again.
Me too. Anytime. Thanks,
Okay,
Adam.
thanks. Take
Okay.
care. Okay, bye bye.
Okay. Bye.